So I'm Shubhi Khurana. I am General Manager for India and South Asia. We are based out of Delhi. So I have about 20 years of experience in health and pharmaceutical world. I started my career with vaccines in GSK. Thereafter, a couple of years in Ranbaxy in branded generics and pharmaceuticals. And then I moved over to Baxter, where I was there for 7 years handling different kind of businesses relating to health and hospitals. I was country manager for Bexalta for India and South Asia for some time, and then moved over to Capsugel as general manager and country head for India region, and now I'm with ResMed. So it's been a very diverse kind of background, handling all kind of possible things in relating to health and pharmaceuticals. Now, both the diseases that we just talked about, sleep apnea and COPD, are highly prevalent in the country. When we look at sleep apnea, I think everyone knows that India is grappling with the problem of obesity, and with obesity, there are other complications which come along, and sleep apnea is one of them. What we know from the studies is there are about 20 to 25% of people in the world, and I think that would hold relevant even for India, who suffer from sleep apnea. So that makes it that maybe 20 to 22, 25% of every 100 that we know around are probably having this problem. But the issue is that not even 10 to 20% would know or would be aware that they have this problem. It starts with the general problem, which is not good sleep, or if you snore too much, generally it is believed that there is a possibility that you might suffer from sleep apnea. But the problem in India is if you snore, it is considered to be that you're sleeping well, which is absolutely the reverse. So, what we are working towards as a company and overall as innovators in this category is to burst this myth, which is if you snore too much in the night, basically it means that you're not sleeping well, and there could be a possibility that you're suffering from sleep apnea. COPD, which we commonly known as respiratory disorders, I think is a very, very serious and a very chronic problem. I think which is in front of us in India. There are potentially more than 300 million people around in the world who are suffering from this problem, and by the sheer numbers, we can say around 1/5 would be there in India. So we are talking about close to 60 million plus people who probably have this problem. And while it starts early in age groups, but as we progress into elderly population, this becomes more and more chronic and more severe. Okay, so sleep apnea, as I just mentioned, is a disorder that not many people know about. While there are about I think every 2 in 10, or let's say every 1 in 4 or 5 patients would be suffering from sleep apnea. Not many people know about it, and the reason that they don't know or they're not aware that they have a problem like sleep apnea, because snoring is considered good or healthy in the country. And while they might be suffering from let's say not a refreshed sleep or fatigueness overall, and but nobody actually goes to the doctor and tells or asks about this problem, because it's, as I said, the myth is about the reverse, and hence low awareness and low diagnosis is something which is a problem in the country. But I would tend to think that with more awareness which is being created both at the physician level and also at patient or community level, is going to help out. It's a new category, it's a new disease area, even in terms of overall existence. in terms of research and innovation in this category, I think it's still evolving. It's a very nascent disease area that people are talking about and learning more about. And as a natural evolution, I think when we talk about India, we still have to grapple with the larger disease areas, which is communicable diseases, then followed with the CVD diseases, which is cardiovascular and diabetes. And then once we evolve to the next level is where we probably will reach out to the disease areas like sleep apnea or respiratory disorders and so on. So it's too early in terms of that cycle. So ResMed has been in existence in India for more than 10 years now and has been working mainly in the areas of creating awareness, both in terms of the doctor awareness about the disease area uh, and the importance of curing and intervention at the doctor level as well as the community level. At doctor level, we as a company do regular CMEs or workshops which talk about the need for early intervention. And at community level, we try doing a lot of patient camps, however they are limited. And that is the reason why we believe that now it is time that we take use of the changes which are happening around us, especially in the digital go to reach strategy with the customers, and create more awareness avenues at the community level about this disease as a problem, because it is not just about the about awareness and intervention. It is also about the impact of this disease which can have on the other comorbidity situations, which is like diabetes, which can be hypertension, which could be uh, stroke, which could also be Alzheimer's. So you are more prone to these diseases if you are not sleeping well or if you have a disease which is sleep apnea. Uh, with the government, it is very early, because I think as a journey, as a company, one starts with with the doctors first and thereafter community, which is still ongoing. At the at the government level, I think as we go on, there will be a lot of work which we need to do with the stakeholders to make them understand, as I said, in terms of the priorities. A disease area like sleep apnea or respiratory disorders, for that matter, uh, you know, come in a come at a later stage. But it doesn't mean that we can't do work or create sensitivity around this area. A lot needs to be done, and I think in the coming years we'll be working in that area. So I'm joining ResMed at a very interesting point where I think some amount of effort has gone in terms of building awareness, and I think ResMed has played a role of a market leader here again, as in the world, and in creating awareness on the category, both in terms of the stakeholders, which are the doctors, and the other is the patients who need to be aware about it. But I think we are at an inflection point where I think we will come in and play a role of awareness building, a large scale awareness building amongst everyone who is involved, which is an undiagnosed patient or a diagnosed patient in terms of better treatment, and the stakeholders. There are many stakeholders which are involved, who all have to come together and make a difference in every possible manner, whether it's policymakers, whether it is doctors, or whether it is treatment providers, which is the caregivers at home, and the patient themselves. I think a lot needs to be done, and we'll be using a lot of interesting things, especially go-to-market strategies and digital strategies to create that difference in the coming years.